Very small skin incision. We would have localized our level of interest prior to doing the skin incision and ensuring that I'm docking exactly where I want to be on the bone. We continue with the x-rays. Yes, I'm happy with that shot. Let's dilators.
It's a medically groundbreaking moment for the country as the Community Hospital of Seventh-day Adventists has brought in state-of-the-art JoyMax equipment from Germany, allowing the facility to offer endoscopic spine surgery, the first of its kind, we're told, in the English-speaking Caribbean. It enables surgeons to enter the spinal cord with a camera attached to a small scope to see and repair the spine. 2 surgeries took place right here in this operating room. One on Wednesday and the other one happened this morning. Now, this can be a game changer in terms of this minimally invasive procedure for some people suffering with spinal issues. Heading the medical team is the first female neurosurgery and spinal consultant in TNT, Dr. Renee Cruikshank, and perhaps the only practicing endoscopic spinal surgeon locally. This is how she describes TNT now having the ability to perform endoscopic spinal surgeries.
I will certainly say that we're ahead of the curve in terms of the adoption of this technology. At the moment, we currently have essentially a mass adoption across the NHS in the UK at the moment. So there are hospitals that still don't even have this technology in lots of places.
A simulation of how the surgery is performed was created specifically for our interview, with imaging from one of the previous surgeries projected on the monitor to allow us to get a better insight into the procedure. Before this advancement, people who needed spinal surgery locally would have either had to travel out of the English-speaking Caribbean for endoscopic surgery or undergo open spinal surgery. Dr. Cruikshank says the latter can be a deterrent to people seeking treatment, in part because of the size of the incision.
With this, and I like to call it ultra-minimally invasive approach, the incision is not more than about ½ centimeter in order to just accommodate the diameter of the scope in order to perform that surgery. So patients find themselves with a lot less pain after surgery. They need a lot less painkillers after surgery, and they can get back to their regular scheduled programming sooner, which is what is really, really favorable.
Apart from that, it reduces the risk for infection, and under normal circumstances, it is a same-day discharge procedure. As for some of the conditions that can be treated through endoscopic surgery,
so this procedure is very good for persons who, for example, they have sciatica, they have an MRI, they have a herniated disc. Also, again, coming into leg pain, you may have changes on the scan where the nerves are very compressed, so you need to make more room for them.
Dr. Alfonso Garcia, who has pioneered endoscopic surgeries in his country of Mexico, traveled to TNT to witness the first 2 surgeries. Chief Executive Officer of the Community Hospital, Dr. Stephen Carroll, says it's a significant investment, but it opens up a world of possibilities, including in the area of medical tourism.
We've had patients come before Guyana, Grenada, St. Vincent to do old school neurosurgery on the spine. So they've been coming, for the past. But recently, there's new inquiries that they're sending their mammogram, their MRIs, but now we're processing them through the new lens. Right. We're not bringing them in to do open surgery as we did in the past.
He tells us while open surgeries can cost around $175,000, it might be possible to reduce the cost by about 20% for the endoscopic surgeries. Dr. Carroll indicates that the hospital is very focused on the local diaspora and he's open to a public-private partnership.
We should be able to collaborate with the ministry and the RHA to provide this to them at a minimal cost. As I always say, nobody's in the business of losing money, but we could do it in a way that's affordable and help the government to decompress its system.
Alicia Boucher, TV6 News.